If you've been told you might need pelvic organ prolapse repair, or you're researching it right now, there are a few things that honestly just don't get talked about enough. And my goal with this video is not to scare you, but to help you feel more informed, more prepared, and a little less alone in this. Because here's the thing. Most women I talk to who are considering prolapse surgery feel some mix of confusion, fear, and pressure to make the right decision. You might be wondering, is surgery my only option? What is recovery actually like? What if it doesn't work or if it comes back? And if that's you, that makes complete sense. There's a lot of information out there, but not always in a way that feels clear or supportive. So let's walk through this together. At a really basic level, pelvic organ prolapse repair is a surgery that's meant to restore support to the pelvic organs. So things like the bladder, uterus, or rectum are moved back into a more supported position. There are different types of procedures, and the specifics depend on your body and your symptoms. But most of the time, it's recommended when symptoms are significantly affecting your quality of life. Now, this is where I want to shift into the part that I think is really important and not talked about enough. Number one, surgery can change structure, but it doesn't always address why the prolapse occurred in the first place. So things like pressure management, muscle coordination, how your body's functioning day to day, those pieces still matter a lot even after surgery. Number two, recovery is often more than just 6 weeks and you're good to go. For a lot of women, there's a longer process of rebuilding of the strength, learning how to move differently, and then feeling confident in your body again. And it's not a bad thing. It just helps to go in with realistic expectations. And then number three is that there's a possibility of symptoms returning over time. This isn't always the case, but it's something to be aware of. And again, this usually comes back to those underlying patterns and support systems in the body and how the surgery was completed. Then number four, there's also a really common perception that prolapse surgeries fail. And I think that this is something that deserves more context because failure can actually be defined in different ways. For example, if a surgery were to give you 10 years of symptom relief and then your symptoms gradually come back over time, that might be considered a failure technically, but is it really a failure from a quality of life perspective? So that could be incredibly meaningful to talk through that definition of failure and zoom out and ask yourself, what does success actually look like for you? Is it reducing symptoms enough to feel comfortable in your body again? Is it being able to return to certain activities? Is it buying time while you're continuing to support your body in other ways? Those are all really valid outcomes, and this is why doing your research, talking with multiple providers, and getting really clear on your goals is so important. Because for some women, surgery may absolutely be the right step to help them get to where they want to be. And then number five, your symptoms don't always perfectly match what's going on anatomically, meaning that some women with more significant prolapse may have minimal symptoms, and then others with mild prolapse may feel a lot of discomfort. So your experience matters just as much as what's showing up on your exam. And this is why I think it's really important to zoom out and look at the bigger picture, because prolapse care isn't just a one-time decision. It's not just, do I have surgery or not? It's really this continuum of support. And then depending on where you are in your journey, there are a lot of different tools and approaches that can help. For example, some women explore conservative options first. Some use additional support alongside surgery, and some are looking for ways to support their body after surgery long term. And this is where tools like HIM can come in, not as a replacement for medical care, but as part of a more supportive whole body approach, something that can help manage pressure, provide support, and give you more options in how you care for your body. So instead of asking, do I need surgery or not, a more helpful question might be, what are my symptoms and how are they affecting my life? What are my goals for my body and my lifestyle? And what kind of support do I want, both short-term and long-term? Because there is not a one-size-fits-all answer here, and your answers to those questions will really dictate your path, and there's more options than people realize. So if you're navigating prolapse right now and you want to better understand your options, I've linked some resources below to help you take the next step in a way that feels informed and supportive. And if this video helped you feel even a little more clear or less alone, that's exactly why I made it. If this has been helpful so far, make sure to subscribe because I post new videos every week on pelvic health and living with conditions like pelvic organ prolapse. I'll see you in the next video.